I really struggled with imposter syndrome. I always felt like, I'm not a plastic surgeon. Why are they going to listen to me? But it turned out to be my superpower. I didn't really have a plan. I just knew I had a mission. I have something important that I need to get done. If you don't pick the right surgeon to get you there, to hold your hand, to guide you through procedure selection, all of those things are really important to get you to that final goal. Complications can happen. And what's important is, how does that surgeon handle difficult situations?
You can't handle the complications, that's probably not a surgery that you should be doing.
If it's not normal, actions need to be done quickly so we can handle this now.
I'ma kick back when you say like that.
So welcome to Beauty Unveiled. I'm Dr. Angela Sturm, and this is where we talk about the truth about plastic surgery, the people getting it, the people doing it, the people supporting the people doing it, and everyone around us. And I'm so excited to have with us today Mavi Rodriguez. She is she has her own podcast, A Big Butts No Lie. She was a patient coordinator for 18 years and then brought all of that knowledge to patients to help them choose the right physicians, choose the right everything before care, after care. She's developed her own Bruise Juice cream, which is amazing. You developed it, come up with it. That's awesome. And then have your own recovery house, and you're a mom too.
I have 6 jobs. I don't get tired.
No, just nonstop going. That's I'm inspired. Oh, how do you? I'll get into everything, but like, how do you do everything all at the same time?
You know what? Time blocking. I time block. So
Yeah.
certain times of my day, so like out of the week, certain times I'm working on one thing, another day I'm working on something else, and just time blocking has really helped me organize. But once my kids get home, that's it. I'm done.
I know. That's what you're doing. You're not getting anything else
Yeah,
done.
that's it.
But it's good. Yeah, exactly. Then you have that time with them. Oh. So what got you into plastics initially when you first started? Did you come in as a patient coordinator, or did you,
So I'm actually
how
a
did you get
medical
into it?
assistant.
Oh,
And
okay.
that's where I came in. I started off as a front desk coordinator and worked every position in the office until I ended it as a coordinator. And
Hmm.
in the pandemic, I left coordinating to try something different just because my kids were little and
Yeah.
I wanted to be home with them and not be at work all day.
Yeah.
But back then, this was just an idea. I still have my
Hmm.
notebook with my doodles of, how can I even do this outside of a plastic surgeon's office? How would this even work?
Yeah.
And thankfully, my I just had a fire under my butt of, I have to help these ladies figure out
Yeah.
how to have safe surgery.
Yeah.
And that's where it all was born from.
Yeah. And I'm sure your experience, in the industry helped you say, this is what I want to do and how I want to do it. And, it's such a scary, exciting thing to take that step out on your own. Like, what did that feel like? And how did you finally decide, this is it? This is what I want to do?
You know, I really struggled with imposter syndrome because when I launched my show, before I launched it, even in the first few episodes, I always felt like, I'm not a plastic surgeon. Why are they going to listen to me? Like, I'm just helping them navigate. I don't have a medical degree. I don't have what you would think you would need to launch a show, but it turned out to be my superpower because I connect with my girls on a,
Yeah.
hey, I'm you, just
Yeah.
different. I
Yeah.
feel I've had plastic surgery myself, so I can also walk them through how they feel during the recovery,
Hmm.
what to expect. And when I started my show, I was like, there's so much to talk about.
Yeah.
We could talk for years
Yeah.
and barely skim the surface of plastic surgery.
Yeah. There's so much. So did you decide you wanted to do the podcast first and then you started like helping the ladies in counseling, or was it all one big idea together?
So before I quit my coordinating job, I had
Hmm.
my same phone number for like 10 years
Hmm.
before, or all these years. And women who I had met 5 years, 10 years before would look for me. They would text me, hey, is this still you? And
Yeah.
so I just was doing it already for
Mm-hmm.
free as a
Yeah.
coordinator, just working, answering, because I'm not going to not answer their text message or not answer
Yeah.
their phone call.
Yeah.
And with the show, I didn't really have a plan. I just knew I had a mission. I have something
Mm-hmm.
important that I need to get done. I don't know how I'm going to do it or how it's going to work, but slowly it just blossomed into what it turned into. My Bruise Juice was initially was my okay, my podcast, and I have my product, which was
Mm-hmm.
Bruise Juice, which I formulated for after liposuction and to help reduce the bruising and the swelling. And my
Yeah.
initial thought was, I had never seen hemosiderin staining until I saw it. And I was like,
Mm-hmm.
whoa, bruises
Mm-hmm.
stain the skin? I didn't know
Yeah.
that.
Yeah.
Well, no wonder these bruises are lasting forever. They need to come
Mm-hmm.
out. And I've figured it out.
Yeah. Yeah, I was just explaining that to a patient the other day. She said my sister had, a lower bleph and she was just dark for a long time. And I was like, it's that you said she needed your cream.
Yeah,
She needed
yeah.
bruise
And
juice.
I had a patient, a lady who reached out to me. She's like, I had 6-year-old bruising, staining, and I started
Wow.
using your product and it got it out. And
That's
I was even
amazing.
shocked. I was like,
Yeah.
really? Wow.
That's awesome. That's great. So how did you formulate this? How do you just go out and formulate a
Well,
product?
first I did a lot of research and I
Mm-hmm.
already had a lot of background knowledge from working in the offices of how, what were the surgeons recommending. And a
Mm-hmm.
lot of times they were just recommending the arnica that it comes in a tube and it's for your joints and it's full of
Mm-hmm.
alcohol. And
Mm-hmm.
I would see women using it, but their skin would dry out. It would
Oh
make them
yeah.
flaky and they're
Mm-hmm.
taking off their faja and all this skin is coming off.
Right.
And I was like, well, maybe we need something that's more moisturizing but has arnica and has properties that help them recover.
Mm-hmm.
And I reached out to companies maybe like 3 companies to see how do I even do this?
Yeah. Yeah.
My question, I'm super curious.
Yeah.
How can I do this? Is this
Mm-hmm.
something that can be done? And just talking and planning and seeing really it was a mission of I'm gonna do something.
Yeah.
I'm gonna make something happen.
Yeah, I love it. This is just such the great entrepreneur story of you have this vision, you have a mission, and you're curious, and you're like, I'm gonna figure this out. I know that this is what I need to do, and there's a need, and just, I love it. I love all the entrepreneur spirit, and oh, that's amazing. Oh,
I did my best. I tried. It wasn't easy. It wasn't always easy.
hmm
There was a lot of moments where when I first launched my podcast, there was no other podcast like what I wanted from a
yeah,
patient coordinator point of view, where
hmm
I'm not talking about the procedures, but I'm bringing surgeons on who are experts in what they do to talk
hmm
about the procedures. So I'm not overstepping what I know. I'm bringing
yeah,
in the experts to talk to my girls,
hmm
tell them what they
hmm
need to know so that they can go on in their own surgery journeys and make the best decisions for them. It
yeah.
was a lot of moments where I was like, am I dumb? Am I, God, please? Is this is really gonna happen? And, I don't know I think there's a saying of like you don't know unless you try, and sometimes persistence is more important than anything. And I was just
hmm
persistent.
hmm I think so. I think grit is the most important thing, that you're persistent. You're like, I'm gonna get this done. I'm gonna do it. And we talked about this like last week. If you haven't had that moment of what am I doing? Is this not gonna work? You haven't been an entrepreneur, We've all been there. We've all done it,
Like, should I just go get a job?
I
Should I just
know, I know. We're like, I'm just gonna go do something else, and then you realize, no, this is where I'm supposed to be. This is
Yeah.
this
Yeah.
is the right.
Well, hearing from my listeners of
Mhm.
getting messages on Instagram once I started my show and really really went all in, getting messages from women who are like, I listened to your show and I took the plunge and I had the surgery and I'm so happy. And
Yeah.
oh my God, I would have never taken the plunge if it hadn't been for listening to your show. And those messages to me were my fuel. And the
Oh
other
yeah.
side, the other fuel was, I wish I had found you before I got botched and I
Mm-hmm.
didn't know what to look for. And
Mm-hmm.
I had these red flags. And so I
Yeah.
had this fire under my butt of, I got to help these women.
Yeah.
I want them to have the success stories, but I know there's
Yeah.
a lot that don't have the success stories.
Yeah. To try to get them on that right path and, in the right direction. Oh, that's awesome that because you help them all the way from the beginning of like, I've never done this before, all the way through recovery, right?
Yeah.
And
Hold
you
their
have,
hand. I hold their hand. We're in for a
Mhm.
ride, okay? Don't get scared. There might be some moments where you think, what the heck am I doing? And what did I do to myself? But just know we have a goal at the end of the tunnel.
Yeah. It's wonderful to have that person that's with you, that's holding the hand and that's, telling you this is normal. This is, it's normal to feel this way because some people, they don't have that. Their family's never done anything like that. And so wonderful to have people like you that can do that for them.
Yeah, I call them, I'm their surgery bestie. We just
Love that.
You can text me what your thoughts are. You call me how you would, Mavi, I saw this and I don't know, or I saw this in a Facebook group. Is this gonna happen to me? And I'm talking them off the ledge of stop reading the Facebook groups,
Oh
get
my
out of
gosh.
there.
Yes. Somehow I got them coming up on my feed, and some of those you're like, oh gosh, please don't look at all these
Please don't
things.
look at that.
I
That's not
know.
gonna happen to you.
I know. Don't look. Don't look. And you have a recovery house. That's amazing. S-
Yeah.
When did you build that, start that? How is that going?
So really the my studio where I have my podcast is my I used to live here, but I don't live
Mm-hmm.
here in this home anymore and it's just my podcast studio.
Mm-hmm.
So the rest of the house was empty and I would have my girls calling and they'd be talking to me and I'm like, "Oh, I wish you were right here with me so I could just go back there and talk to you and see what
Mm-hmm.
you're talking about or we can call your doctor." And
Yeah.
that was really where it was born of. I
Mm-hmm.
want to have my girls that are local here to Houston, at arm's reach, because a lot of times during recovery, they're scared. Is
Yeah.
this normal? And
Yeah.
anxiety gets built up and it's really most of the time it's normal, but to them, because it's their
Mm-hmm.
first time and they
Yeah.
don't know, they can get scared and that anxiety just goes up.
Yeah. It's nice to have that reassurance. We're like, okay, because it's normal to you and me, but they don't know. They've never done this before, just like you said. So
Exactly.
that's super exciting. So when they come to you initially, we were talking about this before, like some people come to this, they have no experience. Like, what are some of the big misconceptions or things that people have no idea about surgery when they come to you that you have to kind of explain? Yeah.
A lot of explaining the differences between a cosmetic surgeon and a plastic surgeon.
That's a
That's
good one.
probably one of the top things that I explain.
Mm-hmm.
A lot of explaining the difference in prices of does it cost $5,000 over here and
Mm-hmm.
$35,000 over here,
Mm-hmm.
and trying to navigate explain the differences and really just show them the red flags of this is
Mm-hmm.
normal, this is not normal,
Yeah.
and helping them navigate through choosing the right surgeon. Because
Mm-hmm.
for me, I always harp on you can do everything right in your prep, but if you don't pick the right surgeon
Mm-hmm.
to get you there, to hold your hand, to guide you through uh, procedure selection, all of
Mm-hmm.
those things are really important to get you to that final goal of
Yeah.
how you want to look.
Yeah. What are some of the major things you tell them to look for in a surgeon? Is it like personality or board certification? Like what are your things that you're like, these are non-negotiables, and then other things that you're like, these are also important.
Yeah, board certification is really important.
Mm-hmm.
We also look at how that surgeon is when you have your consultation. Are they
Mm-hmm.
open to your questions? Are they answering your questions? Do they make you feel heard?
Mm-hmm.
Um, of course, we're looking at results beforehand because
Yeah.
I like to tell my girls, you can ask 10 plastic surgeons to draw a banana and they're all
Yeah.
going to draw it differently. So we just have to find the surgeon that you love their art. You love the way they do
Mm-hmm.
things. And that's really important to find your aesthetic because every surgeon does their surgery differently and they all
Mm-hmm.
have different outcomes. So finding the art that you love
Mm-hmm.
first and
Mm-hmm.
then figuring out, do I connect with this surgeon? Does this
Yeah.
surgeon make me feel heard? Do I
Mm-hmm.
feel safe? Because sometimes I don't know if you've seen of where there it's more of a, okay, have your surgery, we'll see you later, and that's it.
Right.
You don't get to talk to your surgeon ever again, which
Right.
is a huge red flag.
Yeah. Yeah. It's so important because if everything goes perfect, fantastic. If it doesn't go perfect, that's when you need that communication and you need, you know, more than one person holding your hand and you know
Yeah,
what I mean? Need you and
yeah,
need the surgeon and need everybody on the same team of getting things where
exactly.
you know, where you need it to be. Do you do you counsel people just in the US or are they going to other countries? Like, do you know about surgeons in other countries? I just thought
Um,
about that when you're talking.
So I have a lot of women from Canada who come
Mm-hmm.
to Texas, to the
Mm-hmm.
US to have surgery. And I do have women who want to travel outside of the country, for example, to Colombia for surgery. But
Mm-hmm.
a lot of times it's cost related. It's
Yeah.
related to how much does it cost to have the surgery over there. The thing
Yeah.
is, a lot of some of these surgeons in these other countries are very popular and their prices are just as much as what your prices are here. Once you book flights and recovery stays and all of it, you're spending just as much.
Mm-hmm. Yeah. When you look at everything and you know, all together there. And the nice thing is if your surgeon's here, then if there's an issue, they're here, they can take care of it, they can take care of you. No. Um,
Hmm.
what mistakes have you seen people made choosing those plastic surgeons? I know you said there's red flags, like is it the being rushed or like where do you think people get tripped up where they're like, ah, I thought this was gonna
Um,
be really good and
they sometimes they just go see one person and they're like, "This is it. I'm
mm,
having surgery here," and
mm-hmm,
then I don't hear from them until after when they're
mm-hmm,
needing a revision or they're unhappy with their results and they really start doing research and figuring things out and they're like, oh man, I thought I researched, I thought I did the homework, but I'm realizing that I just skimmed the surface. There's so much more to look for.
yeah,
Yeah.
yeah. So how many consults do you tell them to go on?
Usually 3. I'm
Mm-hmm.
like, you're picking your surgeon is like picking a husband because
Yes.
you're trusting this person with your life is going to be in their hands while you're on the operating table, while you're doing all any complicate. I like to tell my girls, complications can happen. If you're paying $2,500 or $250,000 for your surgery, doesn't matter.
Yeah,
Complications can happen. And what's
yeah,
important is how does that surgeon handle difficult situations,
right,
complications? Are they
right.
skilled enough to handle a complication from the procedure
Mm-hmm,
that they're doing with you? Because I have discovery calls for my girls
mm-hmm,
where I'm hearing from them that they spent thousands of dollars
mm-hmm,
and had
mm-hmm,
a procedure just to find out that they had a complication. I had
mm-hmm,
this last week. She had a complication, and her surgeon told her, I can't handle that. You need to go to a real plastic surgeon and sent her to go look for a plastic surgeon. And
oh
she's like,
no,
wait,
what do you mean?
what are you? I thought you were a plastic surgeon. No, he
Yeah,
was not a plastic surgeon. He was a
oh,
cosmetic surgeon who was an
oh,
OB GYN. So
oh wow, yeah, yeah.
I'm sure you've heard.
All kinds of things. There's all kinds of things there. You know, there's people that say they're plastic surgeons, say they will even say I'm a facial plastic surgeon. Like that's very specific, you know, and are really cosmetic surgeons. And I've always felt very strongly if you can't handle the complications, that's probably not a surgery that you should be doing, like do the things that you can fix it, you can whatever it needs to be done. If there's something I'm not completely comfortable with, I just
Yeah,
cannot imagine,
I know.
sending them to
It's
someone else.
scary.
Yeah, that is
It's
scary.
scary for my girls who they want to look better, they want to feel better
Yeah.
in their skin, and sometimes there's a lot of practices that have predatory practices and
Mm-hmm.
a lot of misleading
Mm-hmm.
websites.
Mm-hmm.
Uh, you're searching, is this surgeon board certified? And you go to their website and the verbiage is there, like what a board
Mm-hmm.
certified plastic surgeon is, but it never says Dr. So and so is a board certified plastic surgeon.
Wow.
Or you go
Wow.
look for their license and they're an OB GYN. So
Yeah.
I feel for my girls because they just want to look
Yeah.
better and they just want to
Yeah.
look good and feel good, and they end up sometimes in hands of surgeons who
Mm-hmm.
or doctors who are, you know, learning
Yeah.
how to do these procedures for the first time.
Right. Yeah. And that's your patient. That's somebody's sister, somebody's daughter,
Hmm.
how do you feel about like social media and how things are presented? It's kind of the same vein. You know what I mean?
Those the best social media IG profiles that I've seen are not certified plastic surgeons. Th- Not that
Yeah.
there's some good board certified plastic surgeon Instagrams, but most of
Uh-huh.
the ones that are like, oh my God, look at these
Yeah.
results, look at
Yeah.
this, look at that, they're not
Yeah.
certified. And then you really deep dive and you find out, oh, this is actually photoshopped. These photos are
Oh, wow.
photoshopped.
Yeah.
This is smooth, and there's so many deceptive practices. For example, for my girls, big butts, no lies, they're looking for BBLs.
Mm-hmm.
So they're seeing BBL photos
Mm-hmm.
that are fresh. The person's maybe like two
Yeah.
weeks, or not 2 weeks, 2 days out of surgery. Of
Right.
course, their results are going to look great. But how does that result look in 6 months or in
Right.
8 months?
Right.
And that's something I like to tell my girls, like, look for results, not fresh on the table, but
Yeah.
healed results.
Mm-hmm. I feel like I see a lot of that, like the on table, which, it looks cool and it's exciting. But again, how does that
Yeah.
look, you know, when everything is settled in and all the fat's there that's going to stay? And
Yeah. How much of it actually survives?
yeah, where are you going to be at in the long term? And yeah, there's a lot of marketing and aesthetics that you have to pick through. So it's great people can go to you to help pick through some of that.
I
So what's
just
the
help them navigate.
process?
I just help them navigate. Like, okay,
Yeah.
you tell me what you're looking for.
Mm-hmm.
I'll help you find. I like to tell them I like to see where we are, where we starting, where
Mm-hmm.
you want to be, what your
Mm-hmm.
budget is, what
Yeah.
our price range is. And sometimes it's a lot of just teaching the patient you can't have a full facelift for $7,000.
Right.
And or you can't have a full mommy makeover with breast augmentation and tummy tuck and liposuction and BBL for $8,000 and expect for no corners to be cut,
Mm-hmm.
for everything to be done the way it needs to be done. And unfortunately, on my side, I get to hear a lot of the insider
Mm-hmm.
information, but I don't want to get sued.
I
So
know. Like,
so I don't
stay
talk
secret.
about it. Yeah. I'll tell my
Yeah.
girls, like, I'll tell them during my phone calls if they're like, oh, I'm considering this surgeon, I'll tell them maybe you need to reconsider. But I try to be as kosher as possible with not
Right.
scaring them either.
Right. Right. And give them just the facts and just the information and how to do their research and
Hmm.
help them make good decisions. So when they come to you, like, what is the process? Do they do like a call and then like,
Yeah.
what
So
is your whole
usually
process?
usually we do a discovery call, and in
Mm-hmm.
that call they're getting to know me, but also I'm getting to know them.
Mm-hmm.
Is this person somebody that I can work with? Can I
Mm-hmm.
help them? And if they decide that they do want to work together, I have like a 6 step. system where we do our initial consultation. We talk about what they want, what they
Mm-hmm.
want to look like, what their pricing is, what procedures they would need to get them
Mm-hmm.
to the final look that they're looking for. I have like a list of questions for them to ask the surgeons when they do their
Mm-hmm.
consultations, just so they can get all the information they need to make a
Yeah.
decision. And
Yeah.
then after that, after they pick their surgeon, book their surgery, we start preparing physically,
Mm-hmm.
emotionally,
Mm-hmm.
mentally for surgery, getting them ready for that.
Yeah.
And nutritionally too.
Yeah.
We talk a lot about nutrition,
Oh, that's
getting
great.
them ready for surgery. After
Mm-hmm.
surgery, it's holding their hand. You know, you're gonna be fine. I know you don't like what you're looking at in the mirror right now, but this is not the final result. Don't get
Yeah.
scared. You're gonna be okay. Like, this is normal bruising. This is normal swelling. Or if it's not normal,
Yeah.
help, like getting seeing, okay, this doesn't look the way it's supposed to.
Mm-hmm.
We need to call your doctor. We need to show them this actions need to be done
Yeah.
quickly so we can handle this now.
Mm-hmm. Yeah.
And then maintenance. Most of the
Mm-hmm.
time, once they get through recovery and they start feeling good, I'm like, hey, remember me? How are you doing? And they're off on a beach in a bikini with living
Yeah.
their best life, just
Yeah.
telling me that their life has completely changed. One of my
Yeah.
girls recently told me, I asked her, how do you feel after your surgery? And she's like, I feel like I walked into somebody else's life. Like,
Wow.
who is this? Whose life
Yeah.
is this? This is me.
Yeah.
And yeah, I love those stories.
Yeah. That's so wonderful to be able to be part of that whole process and see them really like blossom and feel good and be
That was my favorite
bubbly.
part when I was a coordinator. And that's the part that I missed when I left. I was
Mm-hmm.
like, I don't miss being at work all day, but I miss talking to my patients as they're going
Yeah.
through the surgery, like seeing them beforehand and watching them walk through the office at 8 weeks
Yeah.
post-op when they're feeling good, their hair's done, they're
Mm-hmm.
wearing perfume, they're wearing a
Mm-hmm.
beautiful dress, and they just feel so light and airy and magnetic and confident. It's to me, it's the most satisfying and exciting part of what I do.
Yeah, it is. It's the best part. That's the part we live for, you know, and you're like, oh, you look amazing, and they're excited, and you're excited. And, it's funny because after pictures, people are always like, they have makeup. And I'm like, getting this girl not to wear makeup is so hard because she feels so good, like she's gonna put it on.
She's feeling good. She didn't wear makeup before because she wasn't feeling that great.
Yeah, and now she's like, I'm gonna put lipstick on these pretty lips, and now I can put on eyeshadow, and you can see it, and
Yeah,
they're enjoying it. They're loving it. So yeah, we live for that. That's the best part for
that's
sure.
the best part for sure.
Yeah. Awesome. Well, thank you so much for joining me. This is so fun to talk with you. And I'm just so excited that everything that you do for your patients and being able to help them step into a new life. I love that. That's such a cool story. So let us know how everybody can find you.
Absolutely. You guys can find me on anywhere with the you can find me on Instagram with Big Butts No Lies podcast, on YouTube with Big Butts No Lies podcast, on TikTok Plastic Surgery Podcast. Or if you want to talk to me, if you need help, if you're looking for your surgery bestie, you can email me at mavi@bigbuttsnolies.com.
Awesome. Thank you so much. Again, this was just really wonderful. And you can find me at www.drangelasturm.com. And thanks for watching.